I'll be giving a multiple myeloma primer, so an overview of really what myeloma is and the current state of treatment right now. So what is multiple myeloma? So multiple myeloma is a cancer of plasma cells, which live in the bone marrow. The plasma cells are a normal part of the immune system. And when they are mutated and when they're growing abnormally, that can be multiple myeloma. It doesn't have a useful name like lung cancer that tells you exactly which cell is the cell of origin. But despite the name, it's a cancer of plasma cells. Oh, there's my disclosure slide. My spouse is employed by AbbVie. So multiple myeloma, in the healthy bone marrow, there are plasma cells there. They're a normal part of the immune system, and they produce normal antibodies, which are responsible for fighting infection. But when these cells grow abnormally and multiply and grow too much, they produce abnormal antibodies that cause the body harm. And we'll talk about what that is in just a minute. But just a little bit of vocabulary related to multiple myeloma. An antibody is also known as an immunoglobulin. So if you see those words, they're interchangeable. And there are two main parts to the antibody, the heavy chain, which is noted here in blue, and the light chain, which is in orange. And this is a protein that's produced by the plasma cells. And as I said, the normal role is to fight infections. But in myeloma, they're not going out and fighting infections. They're causing harm to the body. And sometimes the level of the proteins is called the myeloma protein. It's measured by the M spike. And so those are some words that you might see as you're reading more about multiple myeloma. Multiple myeloma is the second most common cancer of the blood. It's less than 2% of all cancer cases in the United States. There's about 30,000 new cases per year, at least there was in 2018. And over 118,000 patients who are living with the disease. The myeloma is most frequently diagnosed in patients aged 65 to 74, and the median age of diagnosis is 69. And so patients, this is not something we generally see in pediatric populations. So what happens when you have multiple myeloma? So there are symptoms that we associate with active multiple myeloma disease, and the affected parts of the body are often the bones, the kidneys, and the blood. And in the bones, myeloma can interfere with the cells that keep bones strong and lead to normal bone regeneration. And because they interfere with those cells, they can cause thinning of the bone or holes in the bone that can actually lead to bone fractures, which can be painful for patients and limit function. It can also, the same mechanism can actually increase the calcium in the blood. That can lead to constipation and fatigue, but when it's severe, it can also lead to confusion, to seizures, and even to heart issues. And so that can actually be a reason why patients will present to the hospital. The kidneys can also be affected. So myeloma proteins can interfere with the normal filtration of the blood by the kidneys, and this can eventually lead to kidney damage over time, and in some cases even cause kidney failure. And so our goal when we're trying to detect and treat myeloma early is to prevent severe kidney damage that could ultimately result in kidney failure. And finally, myeloma cells also, as they're growing in the bone marrow, which is the factory for normal blood cells, and they can crowd and interfere with normal blood cell production, which can lead to low blood cell counts. So that can increase the risk for infection, fatigue, bleeding, and particularly anemia. A myeloma can present with anemia. And so when we have those together, we call that the CRAB criteria of myeloma, which is an abbreviation for hypercalcemia, so an increased calcium level, that's the C. The R is renal or kidney dysfunction. The A is anemia or low red blood cell counts. And B is for bone lesions. And so those are the things we're really looking for when we're trying to diagnose someone with myeloma.